I already talked about informed consent. It's a process. It's not just a document. And the goal is to ensure that the participant understands the risks associated and the benefits of the study and their rights as a participant. It's a communication. It discloses that it needs communication discourse that respects individuals' autonomy and builds trust. So there's some information here that you can download and look at about informed consent. Yeah, I think I've already talked about this, So obtaining informed consent from patients participating in clinical research is an important legal and ethical process, for researchers. And there's all these links that you can look at. Now, at what stage do we say that informed consent has happened? It will be complete only once the following four things have happened. One is that you have disclosed information and you give the participant time for them to, interact with you and understand if they have any questions, for information disclosure, transparently and openly. They ask questions, you respond. If you don't have the right answer, you can refer and you can ask. You can actually even call the research leads, so that you give the participant the right information. The participant also needs to understand, ensure that they have understood. We are conducting a research study right now that one of the things that happens actually is that after we've conducted the informed consent process, we administer an assessment test to ensure that they have understood the content of the information. It's a clinical trial, so we just want to make sure that they understand the issues that we have mentioned in the informed consent. So we administer that test 3 times. They have to pass a certain mark. There are 15 questions, so 15 mark. Actually, there are 18 questions, and they have to pass 15. They have to get a mark of 15 in all the 3 tests, so that they can be able to proceed to the study, and the study is an ongoing study. So that is one thing you can do, that can happen, just ensuring that the participant has understood. I'm not saying that is the way it's done in all the studies, but just ensuring that the participant has understood about the consent. It's important. Of course, when you're explaining, you are describing and also ensuring that you're competent to conduct the study, but the participant has to only participate voluntarily. And that is why all research, there's normally no payment for participation. You don't pay a participant to participate in a research study. It's voluntary. Whatever monetary things that are given to the participant are actually called compensation. They are just compensating them maybe for their time, or if they have incurred costs for transport or movement from where they were to where the study was being conducted. So you can reimburse that to the study, to the participant. Now, all that we have discussed is during data collection. All this happens